each slide as you go.
Okay, sounds good. I'm Dara Jung. I'm the Director of Nurses at Union General Hospital, and we are located in Farmerville, Louisiana. I am originally from New Orleans, but I have been the director here for 23 years, and we are at the very most north of Louisiana, almost to Arkansas. And we are a critical access hospital, actually, just 20 beds. And we do have to comply with CMS guidelines for emergency preparedness, however, just like all of you do. Some states have different guidelines for emergency preparedness, but we all have to comply with the CMS guidelines. So everything that we do is in coordination with that. So we have a safety director that also assists with our emergency preparedness, and he conducts our fire drills and our monthly in-services with our new hires. We do a monthly orientation. So he goes over our fire plan, explaining the fire drills, what the employee's response is, whether you're a department manager or a frontline employee, and he goes over fire extinguisher use, alarm pulls, those type of things. And then he gets into evacuation situations if, say, a fire turned into the need to evacuate the facility. So he briefly goes into those things with the employees. And then after that, you can go to the next slide. I'm not used to having to say that. He goes over our emergency preparedness codes for the hospital. So these are a list of all of our codes, and we coordinate our codes with the Louisiana Hospital Association, which are pretty much the same all over Louisiana, but every state is different, I'm sure, and every hospital has their own codes. And all the employees are given a badge card when they're hired that goes on their name badge. And so they can reference that when a code is called. If they're not sure, what code yellow means, or, whatever, they can look on their badge to see. You can go to the next slide. So on this slide, on the left is a reference page to the codes. And these are laminated and placed in all the departments all over the hospital. So if a code yellow, for instance, is called, the employee can look down and see what is the code yellow. It also tells them how to page the code, and then it gives a brief explanation of what the code is and their response. So it's just a one-page reference, not very detailed, but just, a brief overview of just actually what the code is. And then we do a little quiz at the end of orientation, just in response to what the codes were and kind of how to page them and how to respond. We also have the code reference sheet can also be used, like if state inspectors come, or if you have joint commission, or we have other inspectors, that come, throughout the year, and they may stop and ask an employee, what do you do if there's a bomb threat? And, people freeze up when they're asked questions like that from inspectors. So you are allowed to use your code reference sheet to say, hold on a second, I have, this reference sheet I can look at that tells me what to do. So they actually like to see things like that. Everybody can't remember everything to do right off the top of their head. So we tell employees it's okay, look on your badge, look at your reference sheet, in response to what are you supposed to do. You can go to the next slide. So we tell them who can call an emergency code in the hospital. So anybody can call a code. It doesn't have to be a supervisor, or we tell the employee, if you're the one who sees the fire, then you call the code. Or if you get the call that there's an influx of patients coming in, we want the employee to know how to call the code. We can page from our phones. So we tell them what number to dial. We have a little button on our phones, and then that pages throughout all of our campus. So we tell everybody, how to do that and where to do that from, so that everybody knows. You can go to the next slide. And we utilize NIMS, which is the National Incident Management System, and that integrates with local, regional, state, and federal agencies throughout all the nation, so that we're kind of all on the same page when it comes to knowing how the incident command structure is. So we require all of our department heads, managers, our charge nurses, registered nurses who may be supervisors on their units, anybody basically that's designated as a supervisor. So even if the supervisor has an assistant, if they're out, whoever may be in charge when that supervisor is gone. So we require all of those people to take these 3 basic courses, and they're available. I'll put the website on there at FEMA.gov. And once they're done, they turn their certificate in to me or their supervisor, and that's kept in their file. And it basically just gives them an overview of what the incident command structure is. So if law enforcement shows up, or whoever shows up, they use terminology and things that we may not be familiar with. So this gives the employees somewhat, at least, of a background. If they hear the words, they say, might say, oh, well, I heard that before at least. It's just a very basic overview of what incident command is. You can go to the next slide. So these are our critical indicators that we report in QA. And I'll be happy to share any of these with y'all as attachments, or however it's easier, Kim, to get those out to people. So we coordinate our hospital safety, employee safety, along with our disasters and life safety codes as our critical indicators. So you can see, like I have on there, the disaster drills. We're required to have 2 per year. So one being a mass influx drill that involves the community. So that's law enforcement, EMS, your Homeland Security. You are required to have that drill. And then another one that could be either a tabletop, so whether you just all get together in a department meeting and discuss what would we do with an active shooter event, or any type of tabletop drill can count as that other drill. Or if you have an actual event, if we just recently had an ice storm here in our community, so that counts as towards, you don't have to have a drill if you've actually had a disaster. So when we do actually have, so with the ice storm we recently had, we knew a few days ahead of time that bad weather was coming our way. So we started a pre-planning meeting. So we called a meeting with all the department managers, and at that point is when you initiate your incident command. So we have a pre-planning meeting, and everybody goes around the room and says, what is their department's response going to be to whatever the event is, that's occurring. So like with the ice storm, maintenance went out, and made sure they had enough rock salt, and had the generators full in case the electricity went out. And we made sure we had enough flashlights and extension cords and all that around. We prepared staff, that what if people couldn't get here? So we prepared staff that lived locally that could stay, or we arranged for law enforcement or our fire department assist with getting our employees here when we have situations like that. So basically everybody just kind of goes around and says, what is your plan going to be in this event? Now, when actual, if there's a mass influx, of course, you don't always have preparation for those type of things. So those are the type of things that you drill so that in those events, you do have somewhat of a plan of what is going to occur when that happens. So after the event, then you're required to have an after action meeting. So your after action meeting is the same people that were in the pre-planning meeting, or maybe any department managers or people that were here for the event that weren't here for the pre-planning but were involved and have input in to say what went well and what went wrong, what can we improve on, the next time this situation occurs. So those are requirements. The after action is a requirement by CMS that you have, whatever situation it is, whether you have the drill or actual event, that you have the after action event. And there are forms for those. I can send y'all that too. Or as long as you have documentation, it doesn't have to be in any formal document, as long as whatever the situation is documented. That's all the inspectors want to see. So we usually have sign-in list and, and things of that nature to show them, along with whatever our notes are that we took for those meetings. And for our fire drills, like for instance, we're required to have 2 per shift per quarter. So your state may differentiate with whatever your life safety code is. So whatever it is, we list those as part of our quality indicators so that we can keep up with, we're staying in compliance. So when the fire marshal shows up and does our annual inspection for our license, then we can say, yes, we did our fire drills, as we're supposed to. So that's just, the critical indicators just kind of help us keep up with what we're supposed to do yearly and monthly, so that we know we're staying in compliance. We also train employees on hospital safety, and this it may not be part of emergency preparedness per se. Some hospitals may have this as part of risk management or your workplace violence, but we just have it part of our safety, coordinated with emergency preparedness. So y'all may have this somewhere else in your facility, but basically we have a 0 tolerance for violence, whether it's verbal or physical, from patients, visitors, employees, anyone on the campus. So we want the employees to understand who they need to contact, what to do if there's an incident. Basically, just if you see something, say something and report it to a supervisor. And then we teach them how to, try to de-escalate situations before they get out of hand. We do require all employees to have either MOAB, which is the management of aggressive behavior, or CPI, which is the crisis prevention training. So we do it for all employees because we're a small hospital and we can, but we try to focus on our clinical employees first in those situations. You can go to the next slide. So in Louisiana, we are fortunate to have a law that they put into place just a couple years ago that it is actually a felony to abuse a healthcare worker, whether it is physical or verbal. if it's reported, they can be convicted of a felony. So we have this signage placed all over our campus, really, all throughout the hospital, and we have a rural health clinic and a therapy outpatient building. So we have these placed all over campus so that people can see the signage, and then, you know, of course, if somebody's in a situation, they can kind of redirect them to, you know, and remind them. We basically just tell them, if you don't settle down, then we're going to call the police. So that signage has really, you know, helped us. So we have that just everywhere. And then, like I said, we educate all the employees on it. You can go to the next slide. So if a situation does occur, we have this safety incident report form that we ask the employees to fill out. Just basically a description of the incident. Was it, most of the time, of course, these situations happen in our emergency department with the emergency department staff, and I'm sure y'all, you know, see the same type of thing. So, but we just want them to be reported so that we know what is going on and how much of it is going on. And then we do actually report these to our state also, you know, to keep up with if there is actually any employee injuries related to violence. But this is, and we tell the employees, you know, it doesn't have to be explicit and detailed, as long as they basically fill out some part of it and turn it into their supervisor. We can always, you know, get with them later to go over, you know, the details of what happened. So